going to talk a little bit about pain and injury. And I drew this visual so that I can represent that. But before we get to it, I just want to talk about three things that while I'm talking here, I want everybody to remember. So pain is a brain event. Every single feeling that you have, both emotional as well as physical, is felt in the brain. So, and every single movement you make, everything, it occurs in the brain. So we have to remember that pain is a brain event. Number two, the severity of pain does not equal the level of tissue damage. It rarely happens, and I'll explain how that occurs and why that occurs during the talk. Number three, nothing happens in isolation. So the body is constantly in flux. Every single tissue affects the next tissue beside it. Physiology of tissues even further away can affect the specific tissue. So we want to make sure that nothing happens in isolation and embrace the complexity of the body. So we'll get to the chart now. This axis here is force. This axis here is time. So force in newtons. The blue line here represents load. So repetitive strain, not a lot of rest. It's just occurring load, 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 load. This green line here represents your tissue tolerance or your tissue's adaptability to load. Okay, so it's constantly in flux here, up and down. It's getting stressed, it's recovering, it's reacting to the load, etc. But once it gets to the point where this load is too much, your tissue tolerance just starts to decline, like so. And it continues to do so until the load actually exceeds your tissue tolerance. And the star right here is where significant tissue damage or failure occurs. Okay. Now, it's not always a situation where it's repetitive load like so. Sometimes it can be a very large load over a short period of time, such as a car accident or a sports injury where somebody gets hit. So that's kind of a short period of time, large amount of load exceeds the tissue tolerance. Now, what affects the tissue tolerance? So some of the things that affect tissue tolerance are involved with metabolism and physiology. So your cell's ability to create energy, to regenerate itself, the ability of the body to bring blood flow and oxygen to that area. So this adaptability is affected by your nutrition, how much nutrition your cells are getting, your general health, your comorbidities, your cardiovascular health, all of that stuff. So specific example, diabetes. Diabetes affects your cell's energy metabolism. Your cells actually can't get glucose. So it decreases the amount of energy in your cell, decreases the amount that it can produce and the amount that it can use to regenerate itself. Diabetes also affects your vasculature. So it affects the ability for your tissues to actually get oxygen and blood and nutrition. So that's going to really affect the adaptability of the system and the adaptability of your tissue. So your tissue tolerance is thereby taking a hit. Now, not only diabetes, there's other things like thyroid problems, cancer, other specific things that are going to really affect the tissue's metabolism. And we're not going to get quite into that. Now, this tissue tolerance can also be improved with exercise, so something we call progressive overload, which is load with enough rest in the middle so that this can actually recover and improve. That's why this progressive overload is here. The maximum tissue tolerance can increase. Now, we're not going to get into it, but there is a genetic maximum where you can't become invincible, obviously. The interesting thing about the tissue tolerance and decreasing to the point of tissue failure is the body, the neurological system, has a fail-safe. And I like to call that line right here the symptom threshold line. Some of you might know that as pain. Okay? So before the tissue tolerance actually reaches a significant level of damage, we have this little fail-safe in place, this symptom threshold line. And that's why it's important to remember the severity of pain is not equal to the level of tissue damage, because pain is known as a signal for actual or potential tissue damage. And that's why this line exists here. It's our body's way of protecting itself from getting injured. And this line, even though I've drawn it here, is actually in flux as well. It can move up and down and all around in relation to specific factors. And now I'm going to talk about those. So it can move up and down secondary to top-down or bottom-up processes. So we'll go into the top-down first. Top-down ways that this line, this symptom threshold line, can increase or decrease is your central nervous system. So your brain, your expectations, stress, anxiety, lack of sleep, beliefs, chronic pain, experiences of pain in the past are also going to change your brain and its reaction to specific loads and pain. So those can actually increase this line to make your body hypervigilant. So even when your tissue tolerance hasn't reached that level yet, it's way up here now, and the system is producing pain way too early because of some of these factors. Now, another top-down process is at the spinal cord, more specifically at the dorsal horn. We're not going to get into very, very in-depth detail about that, but you can also get sensitized at the spinal cord. It's used to constantly getting signals from your nerves saying pain, 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 and it starts to change there as well and get used to sending those signals up to the brain of pain, because pain is a brain event. Okay. The other thing that can happen is some bottom-up process, sensitization of this line. So inside of all of your tissues, you've got nerve endings that are going to feel temperature, they're going to feel chemicals, they're going to feel mechanical stress, and they have a certain threshold to firing to say, hey, this is painful, so that they can protect your tissues. That's that symptom threshold line. And it can be actually increased by peripheral stuff, such as if there's inflammation in the area, sensitizing those nerve endings. You're not getting enough blood flow to the area because you're not taking enough breaks, or it's constricted, or the muscle's constantly been contracted, for example, if we're talking about muscle. It's not getting enough oxygen. It's called ischemia. Those nerve endings are going to get sensitized and increase that symptom threshold line over a period of time. It's called peripheral sensitization. So that's kind of your bottom-up sensitization. And an example would be for inflammation. Let's say you've twisted your knee and some of that swelling with gravity has moved down to your ankle. Sometimes your ankle can even be tender and painful and a little bit sore because that inflammation is sensitizing nerve endings down in there. But there's no actual tissue damage or anything going on there. So it's a very interesting concept. So we've kind of laid out this picture of your tissue adaptability, your tissue tolerance, and how that can be affected by your general health and physiology, and how the body has this fail-safe via the nervous system in place to prevent you from actually obtaining this structural damage. Because the body's very adaptable. It's able to actually take load and react to it and not sustain injury, unless one of these first two is really, really compromised. So I'm going to get into what we're going to do about this, like when the body's a little hypervigilant, or when we're getting to the point that tissue damage is occurring. So the rehab side of things. First and foremost, what we can do, I'm going to work my way back down the pyramid here. We want to make sure, again, nothing happens in isolation, right? So we want to make sure we're addressing all of these factors here. So step one, and the easiest one, is, okay, well, all this load is causing decrease in tissue tolerance and potential injury. Take away the load, right? Ergonomics, micro breaks, activity modification, rest. That's one way to kind of adapt the flux of this system so that it doesn't reach a point of injury. And even when it has, taking away the load is going to help give it some time to this line to recover back up to a point where it's not symptomatic and it's no longer injured. As therapists, we can also affect this flux line. So we can, or the symptom threshold line, where we can affect it again by top-down and bottom-up processing. So we can talk to our patients about education, make sure that their expectations are in place. They're not getting any anxiety or false beliefs about what's going on, the pain. If your patient understands what's going on, it decreases this line and lowers this symptom threshold line significantly because they understand. Now, also neurologically, what we can do is we can affect the nervous system via manual therapy, then your neurophysiological effect, your acupuncture, etc., to feed back to the spinal cord and the peripheral nerves and increase those thresholds. And I'll the therapists know how to do that. I'm not going to get into it with the patients on how that happens, but acupuncture, etc., all that stuff is great. And then lastly, your metabolism and physiology is one way that we can really affect this. And that's why exercise and drills are really, really important, and advocating for our patients, especially when they have comorbidities, etc., to live a healthy lifestyle. Because we talked about this progressive overload, on how that can actually improve your tissue tolerance. And that's the same thing down here, is finding the right amount of load so that the system's not being symptomatic and causing pain, because pain does change movement, and that's going to change how we actually do things, because the body's trying to protect itself. So finding that right amount of load to bring this line above that symptom threshold line and way up here so that it's nice and adaptable is one way that we're going to do this. Alter the physiology, improve perfusion to the system is something we can do. So aerobic exercise, that's really going to help this line recover. Promoting adequate sleep and nutrition, etc., is going to help the adaptive system. So what I'm trying to get with the bottom of this pyramid, and essentially the whole thing, is that we as rehab professionals, yes, we help the system recover and we get you better. But rehab's something you do, not something you get, right? So obviously buy-in's super important. But what we're doing here is we're just making the conditions really optimal for your body to recover and heal it itself. We don't heal you, right? It does it on its own. We just affect different areas of this pyramid here by taking away the load, improving some of the symptom threshold line with some things that we do, and then promoting health and exercise for those tissues to recover so that you can improve from your injury. And that's really important to understand, because once you start to understand this whole process, it really becomes a lot easier to go through it and understand what's going on and why. And obviously consult your healthcare practitioner and your rehab professional to understand where you are in this and what's actually wrong and why it's happening. But understanding some of this, the pain mechanism here and injury mechanisms here, that's going to come a long way in recovery. So I hope that helped, and I hope it didn't get too complicated there.